So that's probably the most important thing that we deal with every single day. You got this is the single thing that a client is coming to us to actually manage and protect for them. At the end of a trial, if you don't have any sound data, you didn't conduct a clinical trial. So it's of utmost importance just to our sponsor clients because of the intrinsic value that it has. Additionally, we have regulatory influences on our data collection as well. 21 CFR Part 11 compliance means that we have to control access and authorization in the systems. But as we start to expand out, especially in collecting information directly from the patients, we run the risk of exposing protected health information as well. So it becomes very important to be following the HIPAA guidelines to that. So we make sure everybody is trained very thoroughly and regularly with regards to any of these regulations that are going to be influencing the work that we do every single day. So that becomes important. Yeah, I mean, one of probably the most interesting side effects for taking on this ISO registration process that we did was really the emphasis that it put on actually driving towards putting some policies and procedures in place specifically around data security. And so we've basically adopted a methodology that we call PDCA, and that is to plan, to do, to check, and to act. So from a planning perspective, we had to really sit down and say, okay, what is it that we're going to do with our data centers? And so we've really focused on a lot of standardization in that area. ISO certainly helped us. The production centers that they have, we looked for industry standards inside of the production centers as well. Then we actually train everyone internally to do the things that we've actually planned on doing, and then we also check on that through audits, internal audits. So we don't wait for a regulation or a regulatory agency to come in and check on us. We don't wait for our clients to come in here and check on us. We have somebody that's dedicated to just that role, to constantly be coming through and basically making sure that we are doing what we plan to do. And then finally, we have a protocol to actually follow up and take corrective action in case we find that there's some non-compliance with the policies that we put in place. So that kind of brings us full circle with regards to that.